The Florida Department of Health is going to be the first state to officially recommend against the COVID-19 vaccines for healthy children.
That was Florida Surgeon General Joseph Ladapo speaking at a panel on Monday alongside Governor Ron DeSantis.
The new guidance is to deter Floridians from vaccinating their healthy children. That guidance says, quote, the risks of administering a COVID-19 vaccine to healthy children may outweigh the benefits. And that, quote, healthy children aged 5 to 17 may not benefit from receiving the currently available COVID-19 vaccine. The announcement goes against CDC guidance, which recommends everyone over the age of 5 get the shot. Child COVID cases spiked during Omicron. At least 4.8 million cases were recorded since the beginning of January.
A CDC study released in February showed hospitalizations of children and adolescents during the Omicron wave was 4 times higher than with Delta. The highest increase was found among children younger than 4. But joining us now to break all this down is Dr. Sonia Rasmussen. She is a pediatrician, an epidemiologist, and a professor at the University of Florida. Doctor, thank you very much for joining us.
Thank you. I'm happy to be here.
And, before we get started, I also want to mention another data point from that CDC study. Hospitalization rates among adolescents ages 12 to 17 in December of 2021. They were 6 times higher for those who were unvaccinated versus fully vaccinated. So given that, why are some Florida health officials and professionals saying that doctors or saying that children may not benefit from this vaccine?
Yeah, I think there's some misconceptions out there about kids and COVID. I think from the start, people have said, well, kids don't get COVID. Kids don't get as severely affected with COVID. It's true that kids are at lower risk, but they're not at no risk. And as you say, there's been lots of hospitalizations. There's been about 1,000 kids that have died of COVID-19. And given that we have a safe and effective vaccine, I think it's important that we use it so we can prevent those hospitalizations and deaths. In addition, we can prevent illness, which keeps kids out of school, and we can also prevent things like long COVID, which I think we don't fully understand the impact of long COVID on kids right now.
All right, so Dr. Rasmussen, let's talk about chickenpox, because the Mayo Clinic says this is a normally mild disease in healthy children. In the pre-vaccine era, it was considered an endemic, and virtually everyone got the illness by adulthood. But since the vaccine program in 1995, cases have dropped by an average of 97%, and hospitalizations and deaths are down about 93%. So while most kids won't get seriously ill, if we have the means, do you believe it's better for our collective public health to nearly eradicate an illness that could negatively impact anyone?
Absolutely. So I remember the days before the chickenpox vaccine, since I've been a pediatrician for a long time. And there were times when kids would come in and be really sick from chickenpox. And yeah, most of the time chickenpox was a mild disease, but it could be severe. And the fact that now we can give kids a chickenpox vaccine, give them the varicella vaccine, and they can prevent those hospitalizations and severe illness that otherwise they would still have. So I think this is really what is the important thing about COVID-19 as well. This is oftentimes a mild illness, but can be severe and can cause death and potentially long COVID as well. Why not prevent that when you have a safe and effective vaccine?
And doctor, given that, what should parents know about getting their child vaccinated against COVID-19? And also, so many parents want to know, why is approval for a shot for kids under the age of 5 taking so much longer than expected?
Yeah, what I want parents to know is that there is a safe and effective vaccine available for COVID-19 for kids 5 and above, and that if they still have questions, the experts to talk to are their pediatricians. Your child's doctor is a person that's been trained to learn about infectious disease, to learn about vaccines, and they've learned a lot the last 2 years about COVID-19. That's the expert to talk to. Now, why is it taking so long for a vaccine for kids under 5? I think that we have to keep in mind that we want to be sure that when a vaccine rolls out, that we can say, we as pediatricians can say that it's safe and it's effective. And right now, those studies have not been completed to show that it's effective. The information we have is that it was shown to be safe for kids under 5, but for kids 2 to 5 years of age, it wasn't clear that it was going to be effective. And of course, we want a vaccine that works and is safe.
Absolutely. Dr. Sonia Rasmussen, thank you very much for joining us.
All right. Thank you.